Now, we have learned a lot with pandemic coming in, and obviously where and what, how we need to go beyond to make this planet a safer planet for us and the elderly to have that. The biggest challenge, I think most of your slides, previous speakers have talked about osteoporosis and the nutritional lacuna that we all have. And today, thankfully, most of the world, at least India, is vaccinated. And we don't need to worry about that in a big way. But yes, the nutrition doesn't come when you and I are old. It starts right from the time that, the small cell that is going to be. And we are going to have a link from the umbilical cord, from the mother. From that time onwards, the nutrition and everything is taken care in the womb to tomb, what we call it as. As an elderly person, obviously, we need to have fitness, not just in one bone, other organs as well. Obviously, heart is a good pump, but heart pumps whatever you and I produce, right? So naturally, we need to have, and obviously, we see a lot of calcium and blockage, which is happening in the blood vessels than in the bone. So this is the biggest challenge we need to understand. And yes, every organ needs to be looked at for the fitness. So that's the reason you and I need to focus on that. Well, activity. I think John has spoken much about it already. Any activity in whatever form, in however way you can do is extremely important to keep that fitness, whatever we can. A simple set of exercises is good enough. And I encourage all this to every patient of mine, 60 and above, definitely. And you may want to go to the gym, you may don't want to go to the gym, doesn't matter. And I encourage each and every elderly person walking in or even online for them to walk rather than walking on the gym. I tell them to walk regularly with the proper footwear outside so that they get good air and good exercise as well. Fitness is not just on the physical side. You need to have mentally as well. And that gives us a full round of approach for the cardiorespiratory endurance, muscle strength, and all that. Because nutrition is not just eating and forgetting it. No. So keeping that in mind, this is taking some time to move on. Okay. Now, the basic nutrition obviously has to be food. And in the food, you have a lot of variants, macro to micronutrients. And, you also need to include our fat. Now, keeping the major thing into play, what we're talking about, after you and I eat, it doesn't just go there. We need to look at digestion, to absorption, to transport of that food, the nutrients what we've taken out to assimilate, and obviously the excretion through the sweat, urinary, and the fecal matters coming out. So these are the things that are extremely important because it's not just one system, it's the entire organ that is important. Mind you, if you and I don't have a good amount of sleep, it's not going to be an easy day or easy days to come in the future. And how many of us have a good night's sleep? A good night's sleep compares and composes of a huge amount of things which you and I can imagine. Enjoy that every moment of our sleep. That's extremely important, That is very, very important. And keeping the similar thing in mind, how often and how much of water that you and I are drinking is also a major, major role playing in our, nutrition take, which is very, very important. And moving forward with that, oops, what happened? Hang on. Are you able to see my screen, sir?
Yes, go back.
Okay.
Yes.
Now?
Yes, perfect.
Okay. Great. Now, thanks a lot. Thank you. Now, with all this, the nutrition from kids to elderly, everyone needs to have that. Obviously, it's a happy family. So keeping that in mind, the nutrition starts with biggest amount of carbohydrates, protein, fat, and all that coming in. Protein, we have a huge amount of thing coming in, and we also require good amount of fibers coming out from fruits and vegetables that we have. Now, it has to be balanced for us. It could be a non-vegetarian source or a vegetarian source or a vegan source. We have different kind of diet that we have, and how often each of us have this balanced plate of food on a daily basis. WHO says you and I need to have 4 to 5 bowls of fruits and vegetables per day. How many of us are eating it? So not easy. And obviously, let me not talk about the kids. Now, protein, nearly 7 to 9 variety of amino acids are not manufactured in our body. You and I need to supplement. When I say supplement, it has to be through the food. If you don't have it, if I don't have it coming out of the food, I need to really supplement the kind of protein that is not there in my diet. So obviously that is a big question that you and I need to ask. So I'm going to repeat, meat sources are there, different kind, but obviously red meat is a no-no for a lot of comorbid conditions. And well, whether you exercise or eat, death is no way out. So balance it. The middle path we talk about. The Ramakrishna Paramahamsa talked always about the middle path. So you have to have the balance, So that's what we talk about. And yes, protein is an ingredient you and I need to have. And one will be wondering as, now, in terms of having a message sent to somebody, now this is where the whole challenge comes into. In the system, we have a messenger RNA taking the whole thing and sending a signal there so that the last part of the reaction or the action is completed. How much do I take per day? 1 gram of protein per kg body weight is extremely important. Why is that? When the protein is not sufficiently given to our body, what happens? Huge challenges. So, I mean, time is less. I won't be able to cover a lot of things, but I'm just going to be running the points there. And then you and I need to have a proper balanced coming in. But yes, vegetarians and vegans, don't get worried. You do get a lot of proteins from the pulses and the nuts. You need to mix and match in your diet. Yes, there is protein, but how much are you and I are focused on taking on a daily basis? Please make sure that you have enough amount of protein from all variety of sources, because we have to have different kind of amino acids, literally the root of proteins, So these are the very good protein squad, peanuts, cashew nuts, almonds, and obviously the walnuts is very good. So please keep them handy. And coming on to the micronutrients, I'm not going to be touching each and every one, but I'll just go touch upon a few basic ones, taking it forward. Micronutrients are vitamins. They are fat soluble or water soluble. We talk about the fat soluble, some of them, and let me not take the whole thing into big way. And India has large amount of deficiency, and we head vitamin A deficient countries in the world. So we need to reverse it. This is as per the standard given to us 2 years ago in 2020. This is very recent and very dangerous thing we are leading. Now, vitamin A gets from all the sources of vegetables and fruits. We have plenty available now. Today, the revolution is talking about organic ones. Look into organic as well. If you and I can afford it, why not? So this is one thing. If you're not eating it, you need to supplement. Well, I don't need to talk much about the sunshine vitamin, vitamin D. Every person in the country is osteomalacic. It's very saddening to say and see patients and people having vitamin D deficiency. Please make sure that you and I are supported well with vitamin D. Let me take you to the water-soluble one. What is that? B and C. I'll take a few minutes there and then we'll take about, and all the 12 vitamins are not covered. I'll just cover a few and then take it forward there. B complex is energy vitamins. Let me talk about a few. And then in that, where do we go? The starting of the B1, the thiamine, very important for us. These are all the things which are coming in. We talk about Alzheimer's and then anti-aging thing. If you and I don't take it in the beginning, why are we worried about in the end? Obviously, it still makes a big difference. You need to take that in a big way. And well, if I talk about the next one, riboflavin, obviously the vision becomes a big challenge for the old elderly people. And anemia is another big challenge. This is another challenge is cancer. So a lot of things are there. Food is obviously giving us, but if you're not having enough of that, then supplement it. So that is where we go. We don't want to have an injection for everything, and it can cause a lot of other challenges, So naturally, B12, I've seen time and again, unimaginable. All my patients I've seen, over 70% of them, I'm just going to give a literature on my online consultations. 100 online consultations which are made, 100 online consultation investigations which have been made, 70 to 73% of them are deficient in vitamin B12. How much? 108, less than 80, 70. It's amazing. It's an alarming situation that I see. And I tell them, today you and I also have the same thing. Because being doctors, we advise, but we neglect ourselves. Let us make sure that you and I take it. We hit 60, forget being hitting 60, because people are getting forgetful even before they hit 60 now, So naturally, biggest challenge, we need to have it. And not only having tiredness, but depression and constipation are one of the biggest challenges that we talk about in elderly. So that need to be looked at, and then make sure that you and I have enough of them, because every vitamin has a big action beyond we talk about, So another few slides and I'll run through. And every vitamin, mineral is important. Vitamin C is an antioxidant. We talk about that in a big way, and then make sure that you and I have enough of that, because the free radicals which are coming in is huge. We need to make sure that we need to kick the free radicals out. We don't want to have a challenge there. Hence, we can't depend all the time on the medical treatment. So you need to make sure that you get enough of that. Calcium, I know there is huge amount of things that we talk about and go on and on. We talk about thyroid. Mind you, you and I forget about parathyroid, which is a calcium and vitamin D hormone. Very important. Minimum 1,000 to 1,500, 1,500 milligrams of calcium through your diet and supplement is extremely important. That is where you need to focus upon. One word on the kidney stones. Yes, people talk about kidney stones, because of taking calcium. Absolutely no. Because of hypocalcemia, kidney stones have been done. What is kidney stone? They're mostly oxalate stones. It is not calcium. Eventually they get calcified, but people blame on that. Let us not talk much about it. Yes, these are extremely important for our defense, because we want to have a defense mechanism which is going to help us out. And we need to make sure we have big amount of helper cells. T cells are important for our system. When there is an antigen coming in, we need to make sure that alarm is sent to T cells. That will set up our, and touch, feel is the big thing, what we do in our, similarly, the T helper cell takes it to a next level. When there's a free radical, body fights. But when there are plenty of free radicals, it may not be easy for the body to fight around and challenges. Hence, you need to have the antioxidants and other supplements to make sure that you and I are covered well, so that we can avoid the challenges that is coming from the free radicals and the immune system. So this is where the whole thing. Let us not make our body helpless. Let us help our body with T cells. The choice is ours, whether we have a toxic cell or a helper cell. No, that is where the whole thing is. One or two word about fat. We talk about, essential fatty acids, non-essential, polyunsaturated, monounsaturated. So many things are there. How many of us are taking, E-codes of pentanoic acid and D-codes of hexanoic acids? Extremely important for us. If you're not a fish eater, take the vegetarian source. Make sure that you take that. Very, very important. Vegan sources are available. You need to have that on a regular basis. One, why? We talk about when there is a huge amount of unsaturated fatty which has been taken here with saturated ones, it becomes an insulin resistant. Today, India is capital city for diabetes. So hence, you need to make sure that you and I have enough of that, puffer so that we prevent and make it insulin sensitive rather than resistant. Let me not take that big way there. And yeah, there are a lot of benefits from that omega-3. So you and I need to take that, make sure, and advocate to everyone. You and I advise, but are we taking it? Is the big question. Now, I said word about today, supplements are there. Supplements are there, but we have a challenge which has been covered because we can personalize it today. With one swab of your saliva, we can personalize the nutrition gap that you and I have. Yes, it costs money, but yes, we can always challenge it and make sure that we take it. And the last couple of slides, and I'm done with. And with this, choice is ours, drugs or vitamins. The take-home message, obviously, the time is running out for geriatrics. Yes, sarcopenia is one. And sarcopenia, we're going to have a major session of 3 to 4 hours. I will be in touch with everybody, and we will be talking only on sarcopenia, which is a major subject. I'm going to finish in 2 slides. And there is huge amount of challenges which we see in our practice. Where and how? We're talking about all these things and causing from sarcopenia. Forget about sarcopenia. People don't even believe that. Today, we have the biomarkers available, microRNAs are available. We can assess the kind of sarcopenia one has it. With this, I end my talk, and I appreciate all of your time.